Everybody's got their
Yeah.
own little field, which is wonderful. So
Yeah, we all work together.
which brings me to the next question, which is the area that you're in that you do impact. What made you decide to go to that area?
So I live in Fayetteville now, and this is actually where I did my undergrad. So I live in a college town, the University of Arkansas is only a few minutes down the road from here. And I would say Fayetteville, well, there's kind of a little area. So there's Fayetteville, Bentonville, Rogers, Springdale, Fort Smith is kind of makes up Northwest Arkansas. And there was just a need for health and wellness services in this area because the only options really are just like major hospitals. And I mean, not everyone's looking for that all the time. There's a time and a place, obviously, to go to the hospital, but not for everything. So that's kind of why I saw a need for that. And then also in this area, there's just not very many practitioners of color. And so I was like, there's a population of color, but not providers of color. So it made sense to me to move where I would be serving the biggest need, which would be here.
Sounds
So
wonderful.
I get patients all the way from birth to, like I said, my elderly patients that are like in their 80s, 90s.
That's so did people know you around that area?
Kind of, sort of, not like necessarily too much. They really knew my husband more than they knew me because he played for the Arkansas Razorbacks. He was a football player.
Oh, wow.
So, he had his moment and all that. So he did do that. We just kind of fell in love with Fayetteville when we lived here in undergrad. And then I moved to Kansas City, like I said, for Cleveland. I lived there for 4 years and then came right back to Fayetteville. My husband's from South Arkansas. I'm from Oklahoma City. It just seemed like a good like halfway point also from like where our families live. That contributed to it as well. But also the biggest thing is that it's just so economically rich here. Like people want the services I have because I don't know if you know, but Northwest Arkansas is the headquarters of Walmart. So like the
I did
largest
not know
company
that.
in the world. They just crossed over the $1 trillion mark actually, I think a week or so ago.
Wow.
Yeah.
Wow.
Yeah. And so there's a wealth for real, an actual wealth of people that are coming to Northwest Arkansas in droves just for Walmart purposes. And those people are needing people like us, they're desk workers, they're doing all these things, and you get, their families along with it. So I just really saw a need for the growing community of Northwest Arkansas to provide some stuff like that. So here we are.
Now, with that being said, is there a portion of your practice that's cash based?
It is, yeah, yep. So I do have a number of patients that do kind of just a cash pay sort of situation. Our office takes insurance, we take cash. We're also in network with Medicare and Medicaid, which we're one of the few offices that is in network with both. Like I said, it's like an accessibility thing. I really don't think that being well and wellness is a luxury service. I think
Mhm.
everyone deserves to be well. So that's why I go out of my way to like take those when a lot of people don't. And
What's
people are like, the
insurance reimbursement
compensation.
like in your area?
It depends on which one you're with. So our office only takes Medicare, Medicaid, AR Kids, which is like the kid version of Medicaid, and then we take Blue Cross as well. Blue
So
Cross Blue Shield.
you're not taking this blanket of all insurances. You pick the ones that you feel are best.
No, we take the ones that actually benefit our patients the most in regards to compensation because we've had a few cases where, for example, the person has insurance, it covers chiropractic, but their copay is more than our cash price.
I've had that
So
happen so many times.
it
Yeah.
happens all the time. So I'm like, it doesn't really benefit you to do that. So,
Yeah.
I mean, I have a few people that are like, I'm working towards my deductible. Like, let's just go ahead and do that. Fine. But most people are like, it's not really in the budget to be paying this much money for a weekly or every 2 weeks visit or something. So that's kind of why and how we chose the networks that we chose to be in because it doesn't really benefit anyone to take the ones that aren't set up for wellness, to be honest.
Doesn't that make you crazy when your fees are actually less than what the insurance companies are asking for?
It's
You can
crazy. It's
make it more
crazy.
affordable?
Yeah, it's like anything I can to like provide access to people. And we also have like a scholarship fund that we set up. It's like a sliding scale situation.
Mhm.
So in the time we've been open, we've never turned anyone away due to finances. It's like we will find a way for you to get what you need.
That's great. So many people really do want to, and they just can't, which is
Yeah,
it's a terrible situation.
it's tough. Which the way that we fund our care fund, I guess, is it's called the Essence Angel Fund,
Mhm.
actually. And we sell merch. So we do like sweatshirts, t-shirts, hats, whatever. And all of that money from the merch goes into the fund that helps pay for our other community members to have care.
That's amazing. I've never heard anything like that in all the interviews and just
Yeah.
discussing anything with people. I've really never heard it. I've heard of people donating, like other patients donating for another person, but that's a great idea. And so if you want to help somebody out, you can do that and still promote your business and do it in a good
Mhm.
way. That's
Yeah.
really cool.
It's genius because, I just got some shirts made for, like, our staff to wear and stuff like that, and some of our patients were like, "Those are so cool, like, I really like that. Is there a place I can buy one?" And I was like, I hadn't really thought about it, but I guess, sure." So we made, like, a little online store, and
Mhm.
it's like a drop shipping situation, so we don't have to handle any of the, like, merchandise or the inventory or anything. They go online, buy their shirt or their hat or whatever, and then it goes straight into the angel fund to help pay for people, so we've been able to write off thousands of dollars of care, actually.
Awesome. So what, like a print on demand kinda situation?
Yeah, pretty much, yeah, so we submit
Cool.
the designs to the people, and then the third-party company that we use, they just handle all of it, they ship it and everything.
Awesome. That's a great idea. And, just to be a little more specific, what third party company do you use to do that?
So we actually use a local company that does all our stuff. So it's called Inked Up Threads,
Okay.
I think. Yeah, they actually just started another shop in Dallas, so they're able to do, like, all across the country now.
Very nice.
Pretty
That's
cool.
it's really cool.
Yeah, they're a Black-owned company too. We like to support, like, minority and women-owned businesses as much as possible, so
Sure. Awesome.
we're always doing a little something.
Very nice. Now, go back to when you first started. Okay.
Mhm.
Sounds like you got a good rhythm going on right now. When you first began, how hard was it just starting out, and how long did it take you to see some progress financially?
So like I said, I did a lot of groundwork at the beginning to make sure that it was going to work out. So I was in the black, net neutral the first 3 months I was open. And then I
Mhm.
started hitting actual profits on month 4 of being open.